everyone. I just wanted to talk a little bit about TOS, Thoracic Outlet Syndrome, and just wanted to share my experience just in a couple different parts. Really, first of all, just the diagnosis and what that experience was like for me, and then also pre-surgery, like how I prepared for surgery, and then also the surgery itself, and then the recovery. So I'm about 2 years out from my FRR surgery. I got the front rib resection and the scalenectomy, and so I know that when I was going through everything, it was really challenging, and I was trying to learn from everyone else that had experienced it before. It was just hard to find people that had experienced it before and had done the surgery, so it was difficult to find those resources. So I feel like I'm far enough out now that I have a pretty good handle on what it was like before versus what it's like now, and just how I feel about it overall. So I just wanted to share my experience with everyone, and really whoever just might find this helpful. If you do, that's great. So feel free to ask me any questions, and I'll try to help out as much as I can, because I do know that it's just a very difficult thing to be dealing with. So yeah, so just a little bit about background on me. I was a swimmer growing up, so I swam basically since I was 9, which, if you know anything about Thoracic Outlet Syndrome, TOS, you know that it is not very common, but when it does happen, it happens in people that are overhead athletes usually, because that repetitive overhead motion, and it happens in people that have traumatic accidents or events or something like that, which I was lucky enough to have both of those things. So so I was a swimmer growing up, and so that probably wasn't the best for my TOS. I will say I did notice something as I was swimming. Well, not really when I was swimming, but when I would run, sometimes I'd feel this pinching in my upper shoulder chest area, and so I could feel this pinching that kind of made it hard to breathe sometimes when I'd run. I also did notice that sometimes my arms would go numb, so I would be doing these exercises, and I'd be holding out my arm, and I'm yeah, I'm totally numb. And it wasn't normal, so I was okay, there's something. It was something, but it was very sporadic that would happen. It really only came up when I did these exercises, so I was if I just don't do these exercises, I'll be fine. So let's just say I was very much predisposed / kind of had TOS before what I'm going to tell you now, which was my accident. So I had an accident when I was riding a bike and collided with a car. So this whole side of my body was slammed against a vehicle, and I ended up having arthroscopic shoulder surgery on my right side, and when I was in rehab for that, I would again be doing those exercises and have that numbness, and so that's when I kind of started to think about this problem that I was having again, and instead of just being a little thing, it was a lot more consistent and bigger. It would go numb faster, and I even then kind of, again, as I was recovering, I started noticing it in daily life. So it was no longer just, oh, I'm doing this exercise and it's happening. It was no, I'm blow drying my hair and my arm is getting tired. So that kind of signaled to me something was more wrong than maybe I'm thinking at the moment. So that was an issue, and the big thing that happened was I was driving for a holiday, and while I was driving, my right arm just completely went numb. I couldn't lift it up. It felt like 100 pounds to try to lift up grab onto the steering wheel. I didn't have like that grip strength. I couldn't, my purse felt like it was like a bajillion pounds. Like, so I was like, okay, this is a real issue. When I get back, I need to like really seek treatment for this and figure out what's going on. So I, I was seeing actually a neck doctor at the time because the accident kind of messed up my neck too. So for a little bit, we were kind of thinking it was maybe a neck issue that was like going into my arm, because everything is so connected. And so I was doing nerve tests. They were, doing MRIs, checking my neck. Really didn't know. But when I was at I think the nerve specialist, they they just like lifted up my arm and they could not find a pulse when they lifted up my arm. So that was kind of something, again, that kind of indicated that thoracic outlet syndrome. And that's when it was first mentioned to me, like, oh, I think you might have this problem called thoracic outlet syndrome, TOS. We're gonna refer you to a vascular, specialist. So, so basically for my diagnosis, my symptoms were numbness, lack of grip strength, pain. Like if I was blow drying my hair, I would have to lay on the couch for like 2 hours afterward because my arm would just be so tired. And then I would sometimes feel this like rush. It felt like water was like rushing through my arm. Occasionally, it would just be like a rush and a weird sensation and stuff. So, and then that numbness ongoing. So I was referred to the vascular doctor, which I ended up going to a few I live in Florida, so I went to a few vascular doctors in Florida and vascular surgeons, and both of them recommended surgery. So the one doctor wanted to do it like from the top, and then the other doctor was going to do it coming in from the side. And it helped to kind of hear both of they both had like different explanations and different reasons that they were diagnosing me and encouraging surgery, I guess. They were different reasons though, and that's what, in some ways it made it more complicated for me, but in other ways the fact that they were both recommending it was really strong for me, because as you know, like a front rib resection it's not a walk in the park. Or if you've heard of it, or if you like look it up, it's not a walk in the park. So if someone's telling you like, we're gonna take part of your rib out, and you want more than one person to tell you, that's probably a good idea. But both of them had worked with a lot of athletes, so that really encouraged me too, because being an athlete, you just have a certain like expectation with your body. Like you're used to swimming, you're used to using it a certain way, and then when someone tells you like, hey, this surgery can help you get back to where you were, and you can, we've seen athletes get back to their normal athletic selves, like that's really encouraging. So they both had their different reasons. As you know, TOS is a very hard thing to diagnose with a test. It's not really something that you can just, we'll do this MRI, we'll see this tear here, and then we'll fix it. Not quite like that. So again, that's something that makes it really hard to make a decision, because there's maybe nothing definitive, and you kind of have to like think in your mind, like, is this what's going on, or is this, in my head, besides like the pulse thing. They did do an MRI where they put like dye in my veins and then did like an MRI with me like holding my arm up and then down, and the one doctor said that there's a lot of blood flow, because the doctor had to take my arm down. It was completely numb after the 3 minutes they did that. So I thought it was normal, and that's another part that makes it hard to decide to have the surgery, is that you kind of sometimes lose a sense of what's normal. I grew up with my arm going numb when I put it above my head. I thought that was normal. I did not think that was weird. So, and then the doctor told me, though, that's actually really not normal. So that can be hard too. And fortunately, since I was hit on my right side, I've been able to compare things to my left side, which gets a little bit numb, but again, it's not like it wasn't the degree of the right side because it had scar tissue now and overhead use and, you know, all of that stuff. So when I did compare it, I was like, oh yeah, there's definitely an issue here. So, which, you know, TOS tends to be a bilateral thing. So again, like if you don't know what normal is, like it can be really hard to diagnose. The whole process from that first doctor saying like, you know, I think you have like TOS, to me deciding to have the surgery was probably about 5 months. So it did take a long time. It's hard to find specialists. It's hard to find doctors. It's hard to find physical therapists that even have worked with it before. I did a little therapy before the surgery, so that I would recommend because again, like it's a big surgery, and if they're saying like, hey, we can try this physical therapy, we'll try to like, you know, manually kind of like push the rib down a little bit and keep it there and work with you to try to build like muscle that opens up that, you know, pathway and stuff, like we'll try and totally do that if you can, because surgery should be last resort. Like you don't want to go in there and mess with stuff if you don't have to. But you know, it's sometimes it's needed. So you know, I would recommend also going to different doctors when you're getting it diagnosed, just because they do have different views on it. It's a rare thing. It's not super common. People don't know a ton about it, especially when it's nerve related. That's really hard to diagnose. So like talk to multiple people. Something that really comforted me with my doctor that ended up doing the surgery was that he was like describing my symptoms without me even having to say things. And it was like, oh, he gets my experience. You know what I mean? Like when you're trying to like explain like this is happening and this is happening and this is, you know, and you're not sure if the doctor is really getting it. I did not have that experience with my doctor. He was like, oh, you feel, you know, you feel this. Oh, you probably, do you have this? Like, do you have this issue? Do you have this? And it was like, yes, like, you know, like what I'm talking about. So I just felt really comforted by that, I guess. So that's another thing I would recommend is, you know, talk to multiple people and, you know, see who you're comfortable with, who, you know, when you talk to, you just get a real sense that they like have seen this before, they've worked with people before, you know, and then of course the support groups. So I joined some Facebook support groups because again, it's not common, and if you don't know anyone that's struggled with it before, like you have no idea. Like, so I went on Facebook and I asked for recommendations about everything and doctors and this and that and what do you all suggest for surgery and that, and I got lots of great ideas. And you know, so try to do support groups, talk to multiple doctors, go slow, you know, try to do physical therapy if you can before surgery, and you know, those are probably my biggest suggestions. But you know, the diagnosis is really difficult, and you know, I just want to say, like, if you're going through that process, like, it is not easy. I don't take it for granted at all that I had so many amazing people working with me, because sometimes you just feel like it's in your head. You're like, I'm going crazy. This is not actually happening. No one is believing me that this is actually happening. So yeah, I really feel for you if that's what you're going through right now. And you know, just try to keep your head up, try to keep pursuing it. You are your best advocate for your health. You know, if you come in and say, I've had this test, I've had these things, here's my folder, you know, they're gonna understand you a lot more than if you come in and you're like, I'm not really sure what's going on. I think I did this test and then I think I did that. Like, no, like, come in there like, here's all my information, now you know, it's like a business deal. Like, you have to go in prepared. That's also what I would recommend. But yeah, it was not an easy process, because it just is not a well-known thing. It's a hard thing to track as it is, and so just be patient, you know, try to be patient as much as you can. But yeah, so that was my story for my TOS diagnosis. I saw lots of doctors. I saw neurologists, the nerve doctors. I saw vascular. I saw neck, like spinal people. So I saw multiple different doctors, because the body's very connected. So you don't want to assume it's like one thing going on when there's really, oh, you really have neck issues. That's what's causing your arm pain. You know, I would not have wanted to find that out after the surgery. So, you know, see all the doctors, and yeah, I mean, just keep your head up and keep going strong. So now I'm gonna share a little bit about my next video. I'm going to share about pre-surgery, so how to prepare for your TOS surgery.